You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. Dudum. This is Back at It with Dr. Decompression.
Let's get started. This is the Back at It with Dr. Decompression podcast. Today, we're going to talk about disc herniations, the top 3 signs and symptoms of a disc bulge, herniation, extrusion, any type of disc injury. Before we dive into it, let's thank our sponsors. PillowWise USA, the most comfortable pillow designed specifically for your neck. I personally use them. And secondly, PowerPlate USA, our whole body vibration plates that we use in the office to bulletproof the lower back and neck to help people recover from disc injuries. I use both products myself. They're amazing. Let's dive into it. Disc bulges, herniations, top 3 symptoms. So let's say you've heard of someone that they cough or sneeze, achoo, and it causes sharp lower back pain. Huge sign of a disc herniation. Number two, are you having leg pain or any referring pain down your leg, below your knee to your foot? Another sign of a disc bulge issue. And then number 3, are you sitting, and when you sit, you have pain in your back and down your leg, or just really bad lower back pain? That's another sign of a disc injury. Let's dive into how does that work? Why is it like that? So number 1, with the coughing, let's look at a disc bulge. Sorry for the listeners out there. I'm going to show you that we have 2 bones and there's a disc right there. That is the disc bulge. The bulge is behind, which is where the thecal sac or the spinal cord, all the nerves are. There's something that's called intrathecal pressure. It's a very tightly pressurized area. You don't want a lot of things or materials like a cyst or a bulge in that area. That would cause pain. When you perform something like a cough or a sneeze, or simply when you bear down to go to the bathroom and you internally create more pressure, it's called intrathecal pressure, it increases the pressure in that area. If there is a disc material or something in that area, it would cause pain. Normally, when you cough or you sneeze, there's no pain in your back that's associated with that. So if you're having pain, if you don't have back pain right now, cough or sneeze. You shouldn't increase your back pain if you have 0 back pain. But if you do have lower back pain, try it. Try this right now. Cough or sneeze. Does that increase the significance of your back pain? Then you most likely have a disc herniation or bulge or some type of disc injury in that area. That's why it increased your pain. That's what happens. It increases the pressure when you do that, and it affects the disc and the nerve that exits the area. So coughing and sneezing would increase the pressure. The pressure, if there's already a substance, increases pain. Another thing, let's talk about leg pain. And then if you're having leg pain, it's probably, if it's down, I'm not talking about leg into the butt, I'm talking below the knee, all the way into the calf or into the ankle or the toes. What's happening is the disc injury, it may be more of a lateral or a sideways bulge. What happens is it affects the exiting nerve root and it puts pressure on there. So if you're having low back pain or leg pain, what I want you to do is try to bend down and put your socks or your shoes on. If that increases the amount of nerve pain you're having, you definitely have a disc bulge. That mimics an orthopedic test called the slump test. When you kind of slump down in your chair and you lean forward, what it's doing, again, sorry for the listeners, but it's elongating the spinal cord. So it stretches the cord. Well, if there's an obstruction in the thecal pressure and you elongate the cord just like that, it's going to cause more nerve issues. Hence, you're going to feel more nerve pain, numbness, tingling, or any sensation into the leg or the foot or the calf. I would say 8 out of 10 of the patients I work with on a weekly basis can't put their socks or shoes on, or they do so with excruciating pain. So a lot of them wear sandals. So if you come into my office and you see, why is everyone wearing sandals for these newer patients? It's because they literally can't put their shoes on so they can slip their foot into something. That's why. So if you're having lower back pain and your nerve hurts and your leg hurts and you can't put your shoes on, put some sandals on. That's what most people do until they work with us and we help them and they can tie their shoes. That's number 2, leg pain, and then specifically putting on your socks and putting on your shoes. It's an orthopedic test. It's the slump test. It's stretching the spinal cord. And if there's an obstruction like a disc injury, it's affecting the nerve and it increases the nerve sensation into your foot or leg. Number 3, sitting for prolonged periods of time increases your back pain. Sitting causes the most pounds per square inch on your disc than any other position. Standing, walking, laying down, none of those put more pressure pounds per square inch than sitting. And what are most of us doing all day? I'm doing it right now for a short amount of time, but what are we doing? We're sitting all day and we're hunched forward on our computer. That's causing more pressure on our discs. That is one of the causes of disc injuries, is sitting all day, degenerating the soft tissue, making muscles weak, and then doing something that causes a flare-up. So when you sit, causes more pressure. Pressure leads to inflammation on that area where the nerve exits, and it causes more back pain or leg pain. Sitting, socks and shoes, right? And then lastly, coughing or sneezing are the 3 most common signs of a disc herniation. When we talk about disc herniations, I want to be clear. Disc bulge versus herniation versus extrusion versus protrusion or slip disc. I'm talking about this whole umbrella of terms of severity. Breaking it down, a bulge, right? We've talked about this in previous episodes. Let's recap. A disc structure is like a jelly-filled donut. You've got the outside, which is the annular fibrosis. That's like the donut of the jelly-filled donut. And then inside the jelly is the nucleus pulposus. That's where all the jelly or the water lives, and it's more fluid, okay? It's more of a cushion. If I was to squeeze the jelly-filled donut, and you can notice the donut sticks out a little bit, but none of the jelly comes out, that would be a disc bulge. It could be 2 millimeters or it could be 10 millimeters. That's a disc bulge. A disc herniation is when the squeeze and you start to see a little bit of that jelly come out of the donut. And you're like, oh, the jelly's coming out. That is a disc herniation or protrusion. And then what's an extrusion? An extrusion is when you squeeze and a whole lot of that jelly's coming out and it's kind of floating places. That would be more of a severe case. That is a disc extrusion. Any one of those types of disc injuries, the 3 most common symptoms are still sitting creates pain, putting on your socks and shoes, or coughing and sneezing or bearing down to go to the bathroom. It's the same for all 3 or all types of disc injuries. So what can you do about it if you are having pain, coughing, or sneezing, or if you sit for long periods of time? Let's be proactive about this approach. Why don't you try walking? Try walking a little bit. Follow us on our YouTube channel or our Instagram or any of our socials and get some tips on some exercises. I want you to try this exercise. If you sit a lot and you have low back pain, I want you to try to do a psoas stretch. And I want you to try to do a cat-cow or a cat-camel, okay? If you do this exercise and it bothers you and it increases your pain, please stop the exercise. It's not the right exercise for you. But it's a really good place to start and see if it gives you any benefit. Another good exercise would be a figure 4 stretch, laying on your back and pushing or pulling your knee towards your body. So it takes pressure off of your lower back and your butt area a little bit. So walking and stretching, you can try different things like ice or cold laser therapy or at-home red light therapy. You can take the edge off of this. And most importantly, don't sit all day. Don't sit. Try to walk. Last exercise, lay on your back. Bring your knees to your chest and then rock your legs back and forth side to side. Again, with no pain. If pain starts, please discontinue the exercise. What I don't want you to do if you've been diagnosed with a disc bulge, or if one of these 3 symptoms are happening, as far as coughing, sneezing, sitting all day, and then lastly, tying your shoes. If you're having one of these symptoms, do not lean forward and stretch your hamstrings. That will recreate pain and that will not be good for you. I don't encourage you to lean forward and stretch your hamstrings. Very common type of a flare-up that patients will get if they do that. Top 3 signs of a disc bulge. We covered those. I gave you some tips to, hey, if you're having these symptoms, what can I do today? I'm listening to this podcast. What can I do, doc? What would maybe change the trajectory of where I am? So ice, red light therapy, don't sit, try to walk if you can. Do not lay around. This will create atrophy of your body. Your body will weaken and your recovery will take much longer. If I see a patient and they just herniated their disc, they come in, they recover a whole lot faster through our decompression program than a patient that has been laying around for 3 weeks or 3 months or 6 months. The road to recovery is harder, it's longer, and it's not going to be as pleasant. I can tell you that. So make sure you're walking around. Some exercises you can try. Try a cat-cow, cat-camel. If it hurts, change the angle. If you're doing a cat-cow or a cat-camel and it flares up the pain when you arch your back and you create a lordosis of a curve, do the exercise, but go until the pain starts and then stop. Do it again and see if after a few repetitions, you can increase that range of motion, which means you're flexing the lower back or the lumbar spine and maybe taking some pressure off of that disc bulge. Try that. Try a piriformis stretch. Okay? Try a psoas stretch to open up your hip flexors and take pressure off the spine. Bring your knees to chest on the ground, knees to chest, and rock back and forth and see if that takes a little bit of pressure off your spine. Do those things. I hope that you got some information from this podcast as far as if you're struggling with a disc bulge, or I'm sorry, if you're struggling with lower back pain and possibly leg pain, and you're not sure what's causing it, if one of those 3 symptoms I told you are going on, you probably have a disc bulge. And I hope I gave you some tips that if that's going on, to try to just make your day easier. Start the recovery process and not atrophy to make your recovery longer. Okay? I want to thank our sponsors, Pillowise USA and PowerPlate USA, for their amazing equipment and materials to help our patients. So if you haven't subscribed to our podcast, you can find us on YouTube and Apple, Back at It with Dr. Decompression. And don't forget to subscribe to our other social channels on YouTube, Instagram. Just look for Dr. Dudum. You can't miss us. Thank you again for listening, and I look forward to seeing you next time. Thanks.